be moving to 39th in Vermont. And one of the benefits of that move is that that third floor is available for us to develop a community reentry center. So the traditional probation services will be conducted on the first and second floor. That entire third floor was vacant, and what we're doing in collaboration with the Office of Diversion and Reentry, LARRP, and other community organizations is developing a community reentry center. What that means is it's a space where individuals will be able to come and receive services, not just by the county agencies that normally provide services, but community-based organizations in that area that know the community, know what the needs are in the community, and will be able to partner with us to wrap services not only around the individual, but the family members there as well. Most of you know that on the juvenile side of the house, we generally work with family members and a whole host of individuals that are within that child's ecology. And it's not so much so on the adult side of the house, but we're trying to change that model where if we're working with the adult probation, or if there are some individuals within their family context that's having some difficulty, they can come to that community reentry center and receive services as well. Our primary responsibility is to the adult on probation, but we want to use that as an open door to help the family. We want the community in that area to know that this is a space, not just to look at it as a traditional probation office, but and we're even trying to think of a different name for it, so it's not viewed again as this kind of a stale law enforcement organization, but a place where the community can come and find hope, healing, restoration. We want the community to own the center, and it'd be a place where they can come and have meetings and have community events and that kind of thing. So, and that's the model we hope to spread throughout LA County. Our second installment, and by the way, the Vermont Community Reentry Center was scheduled to open up in March. We are having a delay, so it'll probably be the end of June, and we'll keep the information flowing through LARRP, so you'll know there's going to be a grand opening, open house, and all of that. We'll invite you to come attend that as well. The second installment of that model is the Martin Luther King Behavioral Health Center. Most of you know that the hospital was rebuilt, and we're taking that old facility, and this is a project under the leadership of Supervisor Mark Ridley-Thomas. That facility will be converted to a behavioral health center, and at one point I believe it was referred to as a restorative village, and it's a partnership again with Department of Mental Health, Health Services, Public Health, Office of Diversion and Reentry, WEDAX, the Probation Department, and the idea is again to provide multiple services, holistic services to individuals that frequent the hospital, individuals in that community that need reentry services, individuals that have all sorts of needs. And the thought is that all those systems that they touch will be in one place and will be able to provide services to those individuals. We will have a reentry center, so we're moving some of our probation operations to that location. We're going to refurbish the basement area, and in addition to the traditional probation services, there will be a community reentry center similar to what I just described at the Vermont facility. It'll probably be a scaled down version of that reentry center, but nonetheless, the philosophy is the same, is that we want not only the government agencies that, or county agencies that provide services, we want community organizations within that community that know the individuals well, that are often the first responders, to partner with us and help provide services to those individuals in that community. We're designing it in a way that does not look like a traditional probation facility. We even have the waiting room is referred to as a living room. The furniture will be different, the artwork, the paint, everything about both of these facilities will be very different and have a more welcoming environment. And not only that, the way that we're working with our probation officers, some of you have heard that we are restructuring everything that we're doing with regards to how we provide services to adult probationers. And we've done some of that in our AB 109 program. We are instituting what we call a core supervision model, and that means we're reducing caseload sizes. We are identifying what the needs are of individuals. We're training our probation officers on motivational interviewing, core correctional practices, and cognitive behavioral interventions with a view towards really trying to provide opportunities for the probation officer to drill down and know exactly what the adult probationer needs, exactly where they have come from, engaging them in helping us to develop a supervision model and a case plan that's conducive to their rehabilitation, and not just having a compliance-based approach to supervision, but a more rehabilitative, more treatment approach to individuals. So it's not just the facility, it's not just all the partnership, but it's just the way that we are approaching supervision all together with a view towards achieving better outcomes. And someone earlier had talked about gender-specific programs. Part of our core model seeks to provide services to females that are in the system that are specific to what their needs are, not just gender-specific programs, but looking at the emerging adult population. We're very well aware of all the brain science around individuals between the ages of 18 to 25 and what their unique needs are. So we're bringing consultants in to help us develop a model that's conducive to that age group, and having probation officers specifically trained and it's sensitive to what the needs are for every age group in that continuum, so that we can work with them and achieve better outcomes. So that's sort of the adult supervision model, and that's the thought around reentry centers. Before I talk about the symposium, are there any questions just about the adult supervision model? And let me just say this too. One of the reasons that we wanted to be on your agenda today is there's a desire to receive your input as we develop. We have, probation has several community advisory committees. We have one that is designed to generally speak to us about how we approach adult supervision. Then we have a Vermont, the first community reentry center that I described. We have a community advisory committee that's helping us to develop the program in that regard. But we really want to get your input on what we need to do in the Martin Luther King program. We want to make sure we engage with you and get your ideas about services there and things that we may miss. Again, we acknowledge that you are the ones that long after probation is done servicing individuals, you are still in the community providing services not only to individuals we supervise, but their family members as well. So we want your input on how we are doing our business. So any questions just around the core model? Yes, ma'am.
What areas do you have services for? How do you get referrals to probation?
Sorry.
What areas do you service?
Well, on these two models, we're servicing the Crenshaw, the area, the catchment area that services the current Crenshaw area. That would be SPA 6. Yes, so SPA 6 for that, and that would be the same on the Vermont. But this model that we're talking about in terms of adult services, that's countywide. So this is countywide, and with that comes referrals to other community-based organizations for services, and that's what the chief was talking about. We partner with Office of Diversion and Reentry to contract for services, and that's still an ongoing work. So we're still designing what services are needed and identifying what services we need to contract for and that kind of thing. So that's still a work in progress, but it's countywide. send some information to Troy, with respect to how you can access, a website that, would have some of that information. And again, that's still a work in progress as well. We're working with our communications person to have a more robust, website that explains all of this, but we'll send that out, through, LARRP as well.
How often do you meet for the advisory?
We meet monthly, and yes, we meet monthly, and again, we have several, so it just depends on which, advisory committee you would like to be part of.
39.
Okay, then, we can get that information out to you through Troy as well.
All the advisory committees listed on the website?
Probably not, but we'll update it. We'll update it. And the reason I say that, we just have a lot of work to do in our web presence. Any other questions? Hey, Mike.
For the Vermont Community Reentry Center, have any of the kind of operating partners initially, at least from day one, been identified, or that's still working with that?
That's still a work in progress as well. And we need to get closer because we're 5 months away from the opening. So we have a sort of a program design, just plugging in who those individuals are going to be. That's the work that we're doing. Not only with ODR, but with the second district. They have a lot of ownership in this project as well. So we should be getting closer. And I would imagine no later than February, we should have identified. Yes. The Reentry Symposium. I'm sure Troy's already talked to you about the fact that we are leading the way in conducting a Reentry Symposium on May 30th, 2019. It will be at the Quiet Cannon in Montebello, 8 to 5, 8 a.m. to 5 p.m. And our desire with this Reentry Symposium is to have a conversation about how reentry is currently being done, how reentry should be done, what is the roadmap to successful reentry, what are some of the gaps in reentry philosophies and services and that kind of thing. So we want to start this conversation. We're going to have subject matter experts to talk about those things that work, what we've discovered nationally, what we've discovered statewide, locally, with a view towards understanding how we should approach reentry in LA County. There's some unique needs in LA County, but we want to draw from all of these resources to have this conversation about reentry. So we'll have local and national leaders that are part of the reentry conference, and we'll get more information out to you about who some of those people are, what the who the plenary speakers will be, what the breakout sessions will look like. And again, if you have some ideas about all of that or want to participate in helping us put some of this together, we are behind the 8 ball a little bit, so there's a time sensitivity, but we still want your input. And again, I would invite you to send that to Troy, and he'll make sure that we get it. But we want to invite all of you to be part of the reentry conference. I believe it's the first of its kind in LA County. We want it to be the best, and we want to be able to build on this for years to come. Yes.
Registration open for that yet? And if so, how do we get to it?
It's not open yet. That's one of the things that we hope to have out to you in the next 30 days. We're working on an entity that's going to help us with all of our PR and pushing everything out. But when it comes out, it's going to come out with a bang.
Put that on the LARRP side.
Yes, it will.
Yeah, we're going to link it to everything. And we want you to spread the word. Spread the word. We have the capacity for about 800 to 900 individuals to run the building place up. May 3rd, so save the date. May 30th. May 30th. I'm getting old. The chief calls herself old, and I'm 5 years older than her, so I don't know where that puts me. But anyway, May 30th, 2019, Quiet Cannon, 8 a.m. to 5 p.m. And we're going to have a little networking thing after 5, so we're just going to hang out that day. Talk about reentry. All right. Any other questions? Yes.
Slots available
Yes, it is. We are, our program committee is meeting next week. And I'll send information out. Some of you are in the room that are part of that committee, so we'll be sending out information and we'll be meeting, and we're gonna be meeting rapidly, starting off in this new year. But there's opportunity for that, and then also opportunity. So the idea behind, so LARRP is a strategic partner in helping to develop the symposium. And one of the ideas is that we really are creating an atmosphere of cross-pollination. Really a conversation is really we're going to be having a discussion around what's happening in the reentry space and really asking ourselves tough questions. What's working and what's not working? How can we improve upon collaboration? And so that is a launching pad. It's designed to be a launching pad for further discussion and to create other types of conversations around reentry in the space. It's not so large, but just smaller discussions around how can we really begin to move the needle. So this is a launching pad for that. And so many of you in the room will be called upon to offer your levels of expertise, to speak on that. And so right now, we're at the beginning stages of asking and soliciting for that. So you'll be getting email from myself or Amy, raise your hand, Amy, around offering up your bios, your information around being a speaker. So that'll be coming out soon.
And Troy is your program chair, so make sure you howl and
Well, they do. So get ready.